If you have pain or difficulty getting out of bed after a surgery, such as a back surgery, abdominal surgery, hip replacement, or knee replacement, or if you just otherwise have difficulty getting out of bed, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'll explain two simple techniques that you can use to make it easier and less painful to get out of bed, particularly after having a surgery. Now, when you have a back surgery or an abdominal surgery, it's contraindicated to sit straight up. With an abdominal surgery, you have to use your abdominal muscles, and obviously if you have an incision there, that's not a good idea. And with back surgeries, your hip flexors, which help you sit up like that, particularly your psoas muscle, it actually attaches to your lower back. So it both compresses the joints in your lower back together, as well as it pulls you into a back arch position, which is especially painful for people with degenerative disc disease or spinal stenosis, or if you've recently had a back surgery. So here's a tip to help get out of bed easier if you're dealing with a back surgery, abdominal surgery, or a hip replacement. And again, with the hip replacement, you can't come up to this 90-degree angle, so you need to find some alternative techniques. To do this technique, you'll start out on your back, and you'll bend one knee up like this. Bend it less than 90 degrees, particularly if you have a hip replacement, and then you're going to roll your whole body as a unit. This avoids twisting at the lower back, which is often painful. So you're going to bring your shoulders, your hips, and your legs over all at the same time. To do this, you'll have this knee up, reach the arm across your body, and notice everything is coming together. You're not moving the bottom half and then the top half, or vice versa, the top half and then the bottom half. So you'll log roll to the side like this, then bring your knees and legs close to the edge of the bed. Then from here, you just swing your feet off the edge and you dig your elbow right here into the bed while pushing up with your arm, and that helps you sit up more easily. Now, note if you do have a hip replacement, just remember to keep this angle less than 90 degrees. Then you'll just proceed to stand up from there, and I have other videos showing how to do that. But let's say you've had a knee replacement and you have difficulty bending your knee and you can't quite get into this position. Well, in that case, you may need to sit straight up. That is definitely not my preferred technique for getting out of bed, but sometimes you just have to do what you have to do. In order to do this with causing the least stress on your abdominals or lower back, dig your elbows into the bed here. This helps press you up. Use your elbows and hands to help you come up to a seated position. Then take your sore leg and cross it over the good leg. And it doesn't matter which one's closest to the bed. But take your sore leg, cross it over the good leg. Then you'll pivot your legs out like this, using the good leg to help control the sore leg down. That helps you to sit up more comfortably if you have had a recent knee surgery. Now, if you're still having trouble getting out of bed, you might consider using a home bed rail, kind of like they have on hospital beds. This one by Loda Hill is adjustable, so it fits various sizes of beds. It just wedges between the bed frame and the mattress to help keep it secure. Here's how you'd use a home bed rail. For example, if you're recovering from a back surgery or abdominal surgery or hip replacement, or if you just have pain in those areas and you're going to be using the log rolling technique, but you have trouble generating momentum to get over on your side, you can just grab onto the bed rail here and use it to pull you over. Then you push up on the bed rail using your arms. Oftentimes that's a lot easier than pushing up from the mattress. Now, if you've had a knee surgery, such as a knee replacement, and you're having trouble controlling your leg down from the bed, you can also use the technique where you sit straight up. But if you do have some back pain along with having a knee replacement, you may not be able just to sit straight up from bed. In that case, you can use the bed rail to help pull you up to a seated position, cross the sore leg over the good leg, and then lower it down like that. Now, there are a few other particulars about this product that you might find helpful, particularly if you're recovering from a surgery and you're spending more time in bed. It has a bedside table that pops up where you can put your phone or other reading material or some water or food. It also has a motion-activated nightlight that if you get up in the middle of the night and you have to use the restroom, you can see where you're going. So if you'd like to check this out, I'll put a link down below this video where you can take a look at it. Or for more tips for neck stiffness or knee stiffness after sleeping, check out these videos over here. Thanks for watching, and I'll see you in the next video.